Hello, good evening, everybody. At the outset, I would like to thank Ajay and Varghese and all the office bearers of IAS, MP, PMM for giving me an opportunity to speak on behalf of such an audience, very learned people, learned speakers, and also learned audience. Today I've been given the topic of the effects of PDE5 inhibitors. So most of the things about PDE5 inhibitors have been covered. Dr. Goyal had covered most of the things about the how the PDE5 inhibitors act, and earlier speakers have also talked about the advantages of PDE5 inhibitors, indications, contraindications, drug reactions, dosage. Everything has been covered. My work is very simple, just to go through the possible adverse effects and how to combat such adverse effects. So once the slide starts, I will start it. I'll just keep talking so that you will not get bored. So adverse effects, mainly, as you know, every day we give so many people these PD5 inhibitors. Out about 10 to 14% of the people, they come out with some or the other adverse effects. The commonest adverse effect which I have seen is the headache and stuffiness of the nose and dizziness. Yeah, next. Can you go to the slide mode and start? Press the slide mode. So most of these PD5 inhibitors have already been talked about, which are the available drugs in the market, their dose. Next one. So these are the second generation medications. These have been touched by the previous speakers. Next one. So coming to the adverse effects of PDE5 inhibitors, the most common adverse effect which we have seen day to day are the headache. 10 to 40% of the people who take these drugs, they come out with the morning effect. That is, night they take, morning they will have a severe headache, sometimes mild to moderate headache, sometimes headache lasts for several hours also. Flushing, nasal congestion, nasopharyngitis, dyspepsia, dizziness, these are some of the commonest adverse effects. How to combat them? Headache, it is very simple. Just most of the times, I always give some analgesic, some Novalgin or Procin or NSAIDs, so that if I tell them, if you get severe headache next morning, you just take one tablet. Most of the times, they don't use the tablet. Sometimes, very few people, they do take the one analgesic that will take care of it. And sometimes, if the flushing and nasal congestion is severe, I add one clomiphene citrate, that is CPM, so that will reduce the nasal congestion. Sometimes I add this Sinarest or any other drug which contains both CPM as well as paracetamol. So they will take both the headache as well as the nasal congestion, because what we have to do mainly is put a decongestant. And nasopharyngitis, just I ask them to gargle the mouth with some salt water, it will go. And dyspepsia, dizziness, they go themselves, but many times I add one B complex so that that will take care of their dyspepsia. And dizziness, it usually lasts for only few hours. Just a little rest, they will be okay. Next slide. So priapism is one of the deadliest complications of these PDE5 inhibitors, though it is very rare, but it can occur, one in say about 10,000 or one in 1 lakh. I have seen about four cases so far. Priapism is a condition where there is prolonged erection lasting more than 4 hours, and it is painful erection lasting more than 6 hours, and it has been reported with most of the times these they would have taken either extra 2 or 3 drugs together or extra dose, or they'll be suffering from some diseases, blood dyscariasis, where the blood clotting less and priapism will occur. In such cases, immediately flushing of the penis has to be done. We have to take an 18 gauge needle, put it into the base of the penis to the corpus, and drain the excess blood. About 300 ml blood has to be drained. Sometimes we have to do saline infusion also. Put the saline on one side of the corpora and start drawing the blood from the other side, so that entire penis will be flushed. You should not draw more than 400, 500 ml blood, because the person may go for anemia. In such cases, you may have to do the blood transfusion also. And if it doesn't subside, even in spite of the flushing of the penis with the saline and injection, you may add one noradrenaline also. And if that is not enough, ultimately you may have to go for a shunt by the urologist. And patients are advised to seek immediate medical attention. What they have to do is, we have to instruct them. If you have any persistent erection, please come back to me as early as possible, because if you don't do that, permanent damage to the penile tissue may occur and lifelong erectile dysfunction can occur. Many times they would have taken one PG in one injection also, that they don't reveal. They just simply say that I had taken only this sildenafil or tadalafil tablet. They would have taken one injection also. Many times they don't reveal. So we have to be careful, take the history properly, and tackle this. Next one. There are several drugs which interact with many of these PDE5 inhibitors. Erythromycin is one. And the problem with these many drugs is they increase the effect of sildenafil many folds, because the plasma level will go from 182% to 210%. So in some cases, they may have persistent erection or persistent headache and other side effects. In such cases, what you have to do is always start the sildenafil from the lowest possible dose, that is 25 milligram only. Only when 25 milligram it won't work, and if they don't have adverse side effect, then go for 50 mg. Next one, please. Same thing with ritonavir and other drugs. They are all highly potent medicines. The whole problem is the sildenafil citrate effect will be increased many folds. So hence, whenever we give ketoconazole or itraconazole or erythromycin or sequinavir or ritonavir, we have to be careful, start always from the lowest possible drug. The best way to combat such a problem is always make a list of the drugs the person is taking, and if the list of drugs he is taking contains any of these, always start with 25 milligram. Next one. So same thing with ketoconazole, that also even tadalafil or even other drugs, udinafil, tadalafil, sildenafil, all of these, they have the tendency of the plasma level getting more, but many times 300%, 500%, 600% also. In such cases, we have to be careful. Start always, even if you start tadalafil, start with 2.5 mg per day. And if the 2.5 mg doesn't work, and if it doesn't have side effect, then go for 5 milligram. Next one. So interaction with medicines, I have told. Avanafil is another drug. There will be multifold, 13-fold increase in the plasma level that may have severe adverse effect. So you have to be careful before giving such a drug for a person who is taking ritonavir or ketoconazole or other similar drugs, ritonavir, other drugs. So nitrates, it's very, very important to note that a person who is taking nitrates such as nitroglycerin, that increases the cyclic GMP, which was very well explained by Dr. Sundar Goyal, who explained how it acts. And the problem with this is there will be a significant increase in the cyclic GMP and resulting in synergetic action. So we had to be careful not to give, can you go to the previous slide? Not to give this tadalafil, sildenafil for a person who is already taking the nitroglycerides, and alpha blockers also. The co-administration of PDE5 inhibitors with alpha-adrenergic blocking result in additive vasodilatation effect, and it may cause severe drop in the blood pressure. That's why persons who have got hypertension, it is better to avoid sildenafil citrate. Tadalafil is a better choice for a person who has got hypertension because of the additive action of sildenafil with most of the people who have got hypertension. And PDE5 inhibitors therapy for ED should be initiated only if the patient's BP is already stable and alpha blockers are at the lowest recommended dose. You can always shift the medicines he is taking from to other drugs which are safer with sildenafil citrate or tadalafil. So this I had told interaction with nitrates. Next one. Alpha blockers I have told. Vardenafil can also have an adverse effect for a person who is already taking alpha blockers by increasing the effect of the alpha blocker so that there will be vasodilatation and hypotension. So visual abnormalities, this may occur in 1 to 2% of the patients who are taking the sildenafil citrate, because the retinal receptors are very similar to the penile receptors in action of the sildenafil, and there will be some blurring of the vision and hollowness, sometimes getting some blueness, and even sudden loss of vision has been reported, very, very rarely, of course. So in such cases, immediately the person should be referred to the ophthalmologist and seek the opinion of the ophthalmologist. And if the person mildly says that he is getting little blurriness of the vision and hollowness, then better you stop the medication and change it over to other safer drugs, or stop the PDE5 inhibitors and go for alternative medical line of treatment like vacuum pump or plasma injection, like that. Non-anterior ischemic optic neuropathy is another condition which has been reported by the persons who are taking PDE5 inhibitors. In such conditions, blood flow to the optic nerve is blocked. So you have to be careful with the visual abnormalities. And if the person says anything about this visual abnormality, please stop the drug immediately. Yeah, loss of hearing, this has been reported, but it has not been directly blamed with PDE5 inhibitors. So only a few cases have been reported in the history. But really whether the loss of hearing occurred with PDE5 inhibitors or not, don't know. But still, if somebody says that there is some decrease in the hearing after taking the PDE5 inhibitors, better we stop so that further loss of hearing damage can be prevented. So back pain, this is another commonest condition. Can you go back to the previous one? Commonest side effect with especially with the tadalafil. They get severe muscular spasm, calf muscles, back muscles, and even arms also. In such cases, just an NSAID will work excellently, but stop the medicines immediately, because tadalafil is one drug which we would have already prescribed for a long time daily dose. And next morning, if the patient telephones and says that he has got back pain, and don't neglect it, first thing is ask him to stop the medicine. Then change over to either sildenafil or amanafil or other drug. But the tadalafil is one which is the which always causes this type of severe back pain, muscle pull, muscle catch, the calf muscle pain. About 4 to 5% of the patients who take tadalafil report this. And the last one, of course, is one slide back, please. The severe anaphylactic reactions, hypersensitivity reaction, they should be just tackled just like any other anaphylactic reaction or allergic condition by chlorpheniramine tablet, or with steroid, or with injection betnazole. So that is just like any other drug. When we come across with allergic reaction, what treatment we would have given with some other drug, same thing is up. Next one, please. Take home message, take note of all the medicines the patient is taking. I always make a note of all medicines he's taking. Many times, ask them if they have got in their telephone the pictures of the medicine they are taking. And if they don't have, ask them to bring next in the next visit. So once we have the list of medicines he is taking, we will be sure that there will be no drug interaction with our medicine. And second is, start with low dose always, especially for youngsters. Don't jump onto 50 mg and 100 mg, because it may have severe side effects. So low dose is always better, because one thing, if there is adverse side effect, it will be of low intensity. And second thing is, if the low dose works, it is good for the patient and good for us also. And wait for 1 or 2 days. If there is adverse side effect, don't continue the medicines. Just stop the medicines. Wait for 1 or 2 days. Make sure that the side effect was due to that drug only. And if you are given multiple drugs, ask them to stop all the drugs. Daily try only one drug. Rule out whether the adverse reaction was for that drug A. If drug A passes the condition, then go to drug B, then drug C, then drug D. So just find out which is the drug which has given the side effect. Stop the drug and change the drug. If there is no side effect, continue the medicines. Stop medications in case of any side effect. Treat symptomatically. Most of the treatment for this adverse side effect is symptomatic treatment, and take the help of other colleagues, call the other colleagues, other sexologist or urologist. And if it is restricted to one specialty, just like audio side effect or visual side effect, always take the help of the other specialties. don't hesitate, because the patient is most important. If he lands up in some problem, the problem will be passed on to us ultimately, and our reputation will go. So always take any side effect complained by the patient very seriously and tackle the problem in the interest of the patient as well as the profession. Next one. So thank you very much for patient hearing. I know that it is already very late, but still about 50 to 60 people have logged in. So I once again thank Varghese for giving him an opportunity. Thank you.